Hello friends, hope you all are doing well, and in this presentation I will discuss about the emergency drug known as atropine. It is one of the emergency drug which is mainly used in many of the emergency conditions. Although there are top 5 emergency drugs like atropine, epinephrine, flusimide, naloxone, salbutamol and many more. But in this presentation I will discuss about the first drug known as atropine. So without wasting time, let's straight in. Atropine, it is a drug which is mainly belong to the class of anticholinergics. Now the question arises, what are the anticholinergics? Anticholinergics are the substance which is mainly block the action of acetylcholine. And the brand name of the drug is Atriza, and the dose is 0.3 mg or 0.4 mg, or it may be 0.3 ml. And the route is IM, intramuscular, subcutaneous, intravenous as well. But if we want to give intravenously, means directly, we have to dissolve the injection, and without dilution we didn't give the injection. And furthermore, move towards the action, means how the atropine work. I will tell you in the detail, means the mechanism of action of atropine, means how the atropine work in our body. For example, these are the body cells. In the normal condition, in the normal body, acetylcholine is act as a neurotransmitter, means it will transfer the nerve impulses, means neurotransmitter means it will transfer the nerve impulses from one cell to another. Okay, if there is transmission of nerve impulses, it will produce the involuntary movement in the body. But when we inject the atropine to the patient, means when we give the atropine to the patient, it will totally block the action of acetylcholine, means there is no acetylcholine, there is no transmission of nerve impulses, and there is no involuntary movement in the body. So it is how the atropine will prevent the involuntary movement in the body. Atropine, here are some indications, means the condition in which we can use the atropine. The first is it act as a antisalagogue. Antisalagogue means it will decrease the amount of saliva or mucus, means if we want to decrease the amount of saliva inside the body, we can give the atropine to the patient. Or it act as a antidote, means when a person engulf or inhale any kind of poisonous substance, or if they are suffering from any kind of food poisoning, we treat the patient with the atropine. And further, it also reduce the spasm, means it will decrease the involuntary movement in the body. And further, it is cure the condition of pylorospasm. Now what is a pylorospasm? Means it will decrease the involuntary movement in the pyloric stenosis, which is a part of stomach. And further, it will decrease the chances of urinary incontinence, means the patient who are suffering from urinary incontinence is mainly treated with the atropine. And further, it also decrease the GI spasm, means gastrointestinal spasm. And further, we will discuss about the contraindications, means the condition in which the atropine is contraindicated. And we will also discuss about the reasons why the atropine is contraindicated. In the glaucoma, firstly, in the glaucoma, the intraocular pressure is already high in the patient, and if we are treat the patient with atropine who are suffering from the glaucoma, it will harmful for the patient. How it is harmful? Because the patient already suffering from the high level of intraocular pressure, and when we inject the atropine to the patient, it will also obstruct the aqueous humor, and it will increase or enhance the level of intraocular pressure, which may cause the permanent blindness. Okay, furthermore, hypersensitivity, means if the patient is suffering from any kind of allergic history of the atropine, we didn't treat the patient with atropine. Further, pyloric stenosis means if there is obstruction inside the pylorus. Okay, if there is involuntary movement, we can treat the patient, but if there is obstruction, we cannot treat the patient. Okay, or if there is any kind of urinary obstruction in the urinary tract or in the urinary part, okay, we didn't treat the patient because it may be harmful for the patient. So before giving the atropine, you have to collect the history of the patient. Either the patient is suffering from any kind of glaucoma or hypersensitivity, okay, then you will treat the patient. Okay, hope so you will learn all about the atropine, and in the further class we will discuss about the another drug. So have a nice day.